to the second video in the series, Management of Patients with Chronic Conditions, Medicare's coverage of diabetes care within the wellness visit. This presentation is designed to support healthcare workers in understanding Medicare's annual wellness visit. This series was originally hosted by Superior Health Quality Alliance and presented by National Government Services in January 2023. During this presentation, you will learn the coverage and required criteria of Medicare's annual wellness visit.
And on this slide that you're seeing before you, it's our disclaimer that says basically we are a contractor of the federal government, and we get our information from CMS, which is the Centers for Medicare and Medicaid Services. And we rely also on Congress and Health and Human Services to determine law and regulations. And as a Medicare administrative contractor, which Kathy will go in more, we implement those laws and regulations as such. Next slide. Thank you, Kathy. Today I'll talk to you about the annual wellness visit and the personalized prevention plan. Next slide. Yes, the Patient Protection and Affordable Care Act of 2010 authorized an annual wellness visit for Medicare beneficiaries, or better known as the AWV. The AWV does not take place of a routine physical exam, which includes different elements in a physical exam as opposed to the annual wellness visit. Annual wellness visits are not a routine physical. Under this benefit, Medicare beneficiaries work with their physicians to develop and update a personalized prevention plan, which can be adapted as a beneficiary's health needs change over time. Unlike the Welcome to Medicare, the annual wellness visit is a service that is covered each year for the patient. Next slide, please. In order for Medicare to consider coverage of an annual wellness visit, the patient cannot be within the first 12 months of their first Medicare Part B coverage period, as a patient is within this time period is eligible for the Medicare to Welcome to Medicare exam. Also keep in mind, if a patient has never received their Welcome to Medicare within the 12 months of their eligibility, and it's past that time, at that point your patient can receive an annual wellness visit. In addition, since this is an annual benefit, the patient is only eligible to receive a covered AWV every 12 months, counted either from their Welcome to Medicare or their last AWV. There are two types of AWVs. An initial AWV, it is covered once per lifetime and has 12 elements. I'm sorry, I meant to say an initial AWV, which is like the Welcome to Medicare, is covered once in their lifetime and has 12 elements. And after the initial annual wellness visit, the patient is eligible for subsequent AWV each year after 12 consecutive months have passed since the last covered AWV and has 11 elements. Who can perform these AWVs? The physician, MD or DO, qualified nurse practitioner, a CNS, an MP, PA, and a medical professional or team working under direct supervision of the physician. Health educator, which includes a health educator, a registered dietitian, nutrition professional, and other licensed practitioners. Repeat, who can perform this AWV is the physician, a qualified MP, a CNS, MP, and PA. Moving on to the next slide. The AWV is conducted through what's called a health risk assessment. The AWV includes an evaluation tool known as the HRA, or Health Risk Assessment. The CDC, or the Centers for Disease Control and Prevention, developed an evidence-informed framework document for health risk assessments, a framework of the patient-centered health risk assessments. The HRA, at minimum, collects information about demographic data, health status self-assessment, psychosocial risks, including but not limited to the depression/life satisfaction, stress, anger, loneliness, social isolation, pain, and fatigue, behavioral risk, including but not limited to tobacco use, physical activity, nutrition, oral health, alcohol consumption, sexual health, motor vehicle, for example, seatbelt use, and home safety. And it also includes activities of daily living, including dressing, feeding, toileting, grooming, physical ambulation, including balance/risk of falls and bathing, and instrumental ADLs, including using the phone, housekeeping, laundry, motor transportation, shopping, managing medication, and handling finances. For more information, you can go to the CDC website under HRAs to get full details of how HRAs frameworks work.
Thank you so much for listening to this session. We hope you'll join us for the other 3 videos in the series. Understand the National Government Services role as a CMS administrator and education and self-service resources. Second, diabetes self-management training. And lastly, medical nutrition therapy.